Very good evening. Sorry for the delay, and you can understand this is the first time we are doing a program with the research, and there are some initial issues. Just trying to sort it out. So, okay. Uh, can I have some response from some of you as to if you can hear me and if you can see the screen? Can somebody type in the question box and confirm if they can see the screen? Uh, how can I get a response from your side if I am now moving through my presentation? Hello, hello. Okay, okay. So shall I start with the present? I've actually had to quit that one. I'm starting fresh. I'm on the first line. Yeah, okay. I am on the first slide, but how can I get a response from people like? Okay, 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 okay. So just it would be a one-way thing. So just if there's anything going in the other direction, somebody can just send me a WhatsApp. Yeah, you can send me. Yeah, yeah, on the WhatsApp if you can send me, because I'll not know when the things go, means when if I get disconnected or something. Okay, okay, yeah. Okay. Uh, So sorry for the delay and sorry for the technical errors which have occurred. I just expect I am audible to you all, and I expect that at least 10 of you are watching this, and you can see the screen which I am sharing with you. So this is the first webinar which we have started in the year 2016. It's Introduction to Research. It's going to be a very small lesson just to give you a brief overview of what we are planning through MSAI in future, right? So this is Doc. Me, Dr. Puneet Gupta, I've completed my BDS from CODS Mangalore, that's Manipal University, and MDS from KLE Belgaum, which was Rajiv Gandhi University, Bangalore. I'd worked for around 2 years in around New Delhi, and then finally I am based in Central India in the Government College Indore. Presently, an associate professor in the Department of Public Health Dentistry. I have been the national advisor for MSAI since it was born, and I have seen this association grow, and it's taken a very nice shape as of today. And I hope it gets a lot of medical students to join MSAI and take things further from here. My passion has been in the area of research training. I have conducted quite a few workshops in all areas of research, and even conducted a couple of workshops at the international level in Europe and in Egypt. But presently, I focus more on doing workshops in India, as well as creating online resource material which stays there for a long time rather than doing live workshops. As a research consultant, I have done quite a bit of work. I have the SPSS certification from IBM, and then I am also associated with Mendeley as an advisor to them. I am associated with a lot of national and international organizations. The chief among them is the Oral Health Working Group of World Federation of Public Health Associations, which is one of the main areas where I work these days. Now, we should talk a bit about MSAI. I'm not sure if somebody else would be able to speak on that, because this is actually maybe a hangout on air, and maybe you're not able to speak. Uh, can somebody introduce MSAI? Can somebody take it from here? Okay, so I'll just brief you about this. MSAI is Medical Students of Association of India, and it's a part. It is the body which represents IFMSA, that's International Federation of Medical Students Associations, which is the biggest association of medical students around the world. Uh, Okay, so it's the biggest association of medical students around the world. Okay, I just got a message that you can hear me and see me, but nobody else can contribute in terms of voice. So that's me who will have to do the speaking, and that's what. Let us all um, uh, be try to be as a medical or dental student, try to be a member of IFMSA and contribute towards it. And MSAI is the official representation of this global group in India. Now they have around 5 or 6 different groups which work. The one which I am now presenting is the Standing Committee on Research Exchange, which has the main target for promoting research among medical and dental students all over the world. So that's briefly about me and associations which are getting it together for you. And this was planned quite a long time back, and I was asked to start a series on research, but even the association is now grown and finally it has taken shape. And that's what we decided, that from the year 2016 we will have this monthly sessions, small webinars, which I want to be interactive. I want to get questions from you, and then we can discuss. The members of MSCI should contribute towards this and try to make it an interactive sessions, which we have planned for monthly on a monthly basis. Now, regarding the timing of these webinars, you can send a feedback if you want it on a weekday or a Saturday or a Sunday, and what would be a comfortable time so that most of you can join these webinars, so that we can adjust accordingly and make it a monthly schedule for you, taking small topics and trying to discuss it and go interactive with these. Now let's come to the topic of our interest, which is research. Now, what exactly is research? That's the big question. So, research is basically synthesizing new information and trying to make sense in a way which is helpful for the humanity, in the sense you discover new medicines or you discover new techniques which improve the health. That's the ultimate aim of any research. You should target your research towards how it can be used for creating better health systems for human. So there are different a lot of ways in which you can do research, and it's actually a vast ocean out there. You have different types of research, and they go into genetics and biotechnology, and then simple things like social research, psychological research. So it's a huge area where you can work. But basically the webinar series will be limited to the very common research techniques and methods which are followed by most of the medical and dental students. So that's a bit about research. Now the second question which comes to our mind is, why should we do research? A few people think research is doing the same thing over and over again, because many a times the research designs are similar, and the even the results which they get are similar. But then why should we do research? The thing is this, among human beings things are very unpredictable. You keep getting new techniques, you keep getting new medicines, you keep getting new type of patients. To just to ensure that a particular thing works, you should always involve yourself in different forms of research. So it's a huge dynamic situation out there, and that's what research should always be done, to know what actually works and what will give the best healthcare or the treatment for a particular scenario. Now, the reasons for doing research can be one of these, which I have pointed out, but there may be a couple of more reasons why you would want to do a research. The first is finding the incidence of a disease. Okay, so what is the incidence of a disease? It's actually how many new cases are occurring, right? So if somebody is interested in something like metabolic syndrome in a particular city, so incidence is like they have to follow the patient over a period. uh, I'll just take a break as I'm getting some queries. Okay, can I'll just take a brief break till we move ahead. There was a lag, I think. There was a lag, I think. Can we have something in the questions as to uh, the way the presentation was going? I think you can send me a feedback through your questions. Can I have a small feedback? Okay. Okay, so now I'll start by talking again about why to do research incidents. As for example, if we have a metabolic syndrome, somebody is interested to work in that area, and they are willing to find out what are the new cases of metabolic syndrome which are coming up in a particular study. They would actually do a longitudinal study. It's more like a kind of a surveillance where you can find the new cases which come up, right? So that would give you the incidence of a particular disease. The prevalence is the total number of cases which are present. So if you want to know the prevalence of a particular disease, you would generally go for a cross sectional survey and find out how many people are suffering from that particular disease at that point of time. Any disease, can be oral cancer or diabetes, anything. The next is etiology. It's very important to find the etiology of a particular disease, because if we talk about AIDS and HIV, it was the initial studies which were done, and they could link some causative organisms with a particular disease. Today we know tobacco causes cancer, lung smoking causes lung cancer, but all this information was gathered through a lot of different kinds of studies which could relate towards the finding the etiology of these diseases. The next is prevention. These can be like, again, now if you talk about prevention, we'll generally do randomized controlled trials and apply a preventive agent and see over a period of time as to how much disease could it stop. Okay, the same similarly for therapies. Again, we provide therapies among different people and just follow them over time and see what is the effectiveness of the therapy, a surgical or a medical therapy for curing a particular disease. Presently, we are also interested to know about the harms. New medicines are coming up and new techniques, and then we're interested to know what are the side effects or adverse effects of these newer techniques. So just as we evaluate therapy, we would also evaluate what harms can a particular thing causes. Next again is prognosis. When we try something new and follow them up and see how well the patient behaves after going through these things in the prognostic point of view. Then there are some other type of things which you will may be interested to know, and may your research be targeted towards these are like trying to find what is the diagnostic accuracy of a particular method. Now you have all these computerized radiographs, you have the MRI, CT scans. So are they effective? Are they better than an old method in detecting a particular disease, in diagnosis of a particular disease? Because as you all know and understand, any diagnostic tests would give you true positives, true negatives, but they would also give you a lot of false positives and false negatives. So you have to aim your diagnostic test such that you get the best results out of those. And then again, you have these studies which are targeted towards agreement. Mostly these may be done as to what is the agreement between two different people looking at a radiograph and trying to give their diagnosis, or two different histopathologists as to their opinion on what the slide shows as a disease, or maybe different people checking different staining methods and seeing what is the agreement of finding a particular disease with these two different staining methods. So all these are different types of studies, which means reasons for studies which you can pick up. The next we'll talk about is what are the different types of research. So to start with, we have what we known as basic or applied research. Now, what is basic research is, the other way to put is, basic research is not yet applied research. Now, these basic research is something which is generally carried out in the labs. They are carried out on different chemical molecules or gene structures, or they are presently we have these in silico drug design or genetic modification. So all these are something which are not actually happening on the people, or they have a direct impact on health, but they are being done at the backstage. They are trying to develop some new chemical which has a different kind of attachment to a certain human receptor molecule. So that's all which is going behind. That's not that's called basic research. It goes on in labs basically. Now, what is the applied part? The applied research is generally done more on the human beings and trying to see what effect a particular thing may have on the human beings. Suppose a chemical was developed which had a different kind of attachment to a particular human receptor, to make that molecule into a form which can be ingested by humans through a way, and then how that reaction with that particular receptor would change the health of a human being. That's what comes under the domain of applied research, right? So these are different, both have their own advantages and disadvantages. But for basic research, you would have to work a lot with engineers, the chemical engineers, or the biotechnology specialists. Applied research is more of a medical domain specific thing. The next classification of research probably is the qualitative versus quantitative kind of research. Now, there's a difference between defining qualitative and quantitative variables as compared to qualitative and quantitative types of research. Qualitative research goes in depth into a particular topic. Generally, they don't involve variables, and good examples of a qualitative type of research can be an in-depth interview. An in-depth interview where we are not following a questionnaire. We don't have a questionnaire, but we are asking you about what are your patterns, or we can take a quick feedback from all of you, and you can type in whatever you want about this webinar, right? So that's an in-depth interview. Now, the focus group discussions, where we have a group of 8 to 12 people sitting together and interacting and talking about a particular topic. These can be focus group discussions, or it can be simple observations. The researcher sits and he watches how people behave, right? You just sit on the at a road traffic junction and see how people behave, and then how road traffic accidents happen. So it's all your observations, just seeing what happens. Quantitative research, on the other hand, involves a lot of numbers. They involve variables. It can be hemoglobin, blood sugar, your height, weight. Now, suppose if we send you a questionnaire after this webinar and ask you to rate the webinar, and there may be questions like, was the voice clear, was it audible, not audible, was the speaker speaking too fast, or was he speaking too slow, right? So all these things, or how was the means quality of the presentation. So all these can be good, bad, poor. So these are like structured where you have a fixed answer. But what I would like is qualitative research, wherein I'll just ask you how was the webinar, and you can type whatever you want. You can say it started late, but then it went okay, or I was speaking too fast, or not clear, or not audible. Where you have, where I can get an in-depth response to minor details and everybody's perspective about this. So that is qualitative research, goes in depth into things. Quantitative research, on the other hand, will bind you into a certain areas where you can answer, uh, and you'll have to fixed variables through which you'll answer, and then also you'll have fixed options within which you will answer. So that's the difference. Qualitative research itself is a big domain, and will not talk much about that during the series. What we will focus on is on the quantitative research, which most of the medical students undertake. The next is primary versus secondary research. Now, primary research is one wherein you, as a medical researcher or as an investigator, go actually in the field and collect the data from the people, or whatever your unit of inquiry is. You actually go out in the field and you yourself collect the data. Secondary research, on the other hand, is somebody else has collected data and you use that data for your research. Now, examples of secondary research are narrative reviews, in the sense that 10 articles are written about a particular surgical technique. So you combine all that, and then you write an article about advantages, disadvantages, contraindications, indications of a particular surgical technique. So you are not doing any that technique directly on the patient, but whatever is published, you are using that to comprehensively tell about that particular technique without you actually doing something on the patient. So that's secondary research. Then you have the systematic reviews and the meta-analysis, which again is a huge topic, and it falls under the domain of evidence-based medicine. And evidence-based medicine is something which is very dear to me as a topic, and I have been trying to do some work with respect to evidence based medicine. So that would come up at least as one or two webinars somewhere later, once we are done with the simpler topics related to research. Now, what are the different types of research which you can do? So letter to editors, is it research? I leave it up to you, but then letter to editors are important. If you find something interesting, you should write it to letter to editors, because you may not find something which is as huge to be published as a research article, but it can be published as a short a letter to editor, in the sense, if you found some patient with a totally different type of a psychological behavior which is not mentioned in any book or not there in any paper, you found something very peculiar about a patient in a psychological ward, you can write that as a letter to editor. Or if you see something major happening or something changing in the field of medical education, then again you can write that probably to one of the journal which talks about medical education. So all these are important. Next, you have the case reports. Is it research? I'm not sure, but then these are something you saw a patient, or you did a new type of a surgical technique on a particular patient which you want the world to know, and other people should use that technique, and in times to come people should use that technique, in the sense, in the form of a randomized controlled trial, and maybe check the efficacy of that technique or that medicine. So but presently you just have one case report, so probably you can publish that. And then similarly you have the case series where a group of patients were treated in a particular way, and they showed something. So case series, case reports, they are very important, because if if we know so much about HIV and AIDS today, but it all started with case reports and case series when doctors from South Africa reported these homosexual males who had infections which couldn't be cured by normal medications, antibiotics. So it all started with case reports and case series, and then it today it's a huge area of research, as you know, the HIV and AIDS, right? So it all starts there. The next thing, the most common medical research designs which all of you know and are generally interested in are descriptive epidemiology or the surveys. Then you have the cross-sectional studies, which are analytical, case control studies trying to find the etiology, cohort studies, and then finally you have the experimental studies designed, which are generally the randomized control trial. These are the most common epidemiological study designs, which you most of you know about this, but when we come to subsequent webinars we'll talk about each one of these in a little more details. The other research designs which are very specific to a particular area of interest, they can be questionnaire studies. So there are a lot of questionnaires which are validated throughout the world, so you can use them and you do all these studies about knowledge, attitude, practices. But then it's a whole new domain as well. If suppose you want to, a lot of these questionnaires are developed by the Western world and may not be applicable to the Indian scenario. Even if it is applicable, you may need to change a few things in that. So there are a lot of issues on validity, reliability of questionnaires, and then all those things should be incorporated whenever you are doing a questionnaire type of a study. Then we have studies trying to find about the diagnostic accuracy. You need to understand the concepts of sensitivity, specificity, and of late you have these newer concepts of receivers operating characteristic curve and area under the curves, which will tell you which diagnostic test is better and what should be the cutoff value for a particular disease. So all these concepts come in from there. Then you have these survival studies. This is a very special type of study, mainly being done in the area of cancer research, right? So wherein you have patients who join you in different months, Jan, March, then August, and then they stay with you for different time periods. Some of them die, some of them survive. So you have to find which are the methods which gives best survival rate and all, because this is a composite thing as to how many years was the patient under your observation, and then after that was did he survive or did he die. So these are again a new type of studies, which I call as the survival studies. The next is the agreement studies. As we discussed, we have to find agreement between two staining methods or two histopathologists or two methods of taking radiographs and see which is better, right? So these may be the different research study designs. Now, coming to the last topic, what are the different steps? These are the more or less the common steps which you would be required to undertake in any research. Now, the first step is topic selection. This will be based on what your area of interest is, whether you want to do your research in the area of medicine or surgery or which drug or which department. So that's based on your area of interest that you will be selecting the topic for your research along with the supervisor. It should be interesting for both of you. The next step probably is to do a literature search and find out what information is actually available about that particular disease or that particular medicine, to build the background data, like the review of literature and your introduction as to what is already known about the your interest area. Now, searching literature is again in itself, we can take a half day workshops on literature search using PubMed, And then also you have sometimes PubMed doesn't give you enough articles, and then probably you can shift not to Google but to Google Scholar, where you can find some more literature regarding the particular disease or intervention. But then literature search is not something vague that you should just type on Google and try to find. The importance here is your search should be very specific and sensitive, as we talk in terms of diagnostic accuracy, in the sense you should get the all the studies which are related to that topic, and you should get minimal studies which were irrelevant, right? Because Google would send you 1 million relevant things, but you don't have time to read all that. So PubMed is a better thing, and then you have to train yourself on how to use PubMed to get the best search results with you. The next is preparation of a protocol. Now, preparation of the protocol is very important. It's called the synopsis, or it's called the proposal, whatever name you give it. But this is the place where you'll have to justify the need for doing this study. You'll have to write briefly about the review of literature based on the literature search, what knowledge is already known, and then you'll have to talk in details about what is your study design and other aspects, like what are the epidemiological considerations of your study, what study design are you following, and within each study design there are a lot of things which are need to be taken care of. And then what is the data which you will collect, how will you analyze the data, how will you go around with the data. So all these things have to be discussed in your protocol preparation. And the most important thing is the protocol should not change during the research phase, and if it is changed, it has to be a justified change. The next is ethical clearance, which you will get from mainly your ethical review boards of your colleges. And even if you are doing a questionnaire study, it's important to get an ethical clearance, because many times you ask the patient to sign, or you take some sensitive data about that patient. So there has to be a declaration somewhere that you will not use this data anywhere. So it's always better to apply for an ethical clearance even for the simplest study which you undertake. And then funding again is interesting, because a lot of us self fund our studies, but then there are other places which do fund, which are ready to willing to fund for you. One of the most important is ICMR, the Indian Council for Medical Research, which funds medical students for short-term research. And then there are, as you grow as a researcher, you'll find many opportunities with respect to national and international agencies willing to fund your research, because as a researcher you definitely need funding to go ahead. Now, these were the steps which you will be doing before you actually go ahead and do the study. Like, these are all the planning stages. Once you go ahead, you collect data, you do some intervention on the population, and then you go in the post-study phase. You have the first step, which is known as data analysis and interpretation. It's not just analysis, but what sense does the data make, what does it mean. That's the interpretation of the data, which is very important. Along with interpretation, you also, data analysis and interpretation is a big topic in itself, because you need to know everything about statistics to make sense and analyze your data. Now, data presentation again is very interesting, because if you're sending your research for publication, the editors generally allow you a very limited space in terms of tables and graphs to present your data. So it becomes very interesting as to how concisely you can give the maximum results in form of tables and graphs. So that very interesting as to how you present your data. Next is dissemination of your research is very important, and it can be done by report preparation. The report can be some report which you are sending to ICMR, or your dissertation, or your thesis which you are submitting to your university. So whatever it is, it has to be the whole research process has to be documented very well and put there as a report presentation. The next is research presentation, which can be done in forms of posters or it can be done in form of presentations at conferences. Both of these are interesting. Preparing a poster, you need to know the basic skills, some DTP skills, and when you are presenting your research at a conference, you need to be good with public speaking and communication skills, as well as use good tools for presentation. We tried today morning to use Prezi for this presentation, but that doesn't go very well with the Hangout. So we actually switched to Google Slides. So you need to know these presentation softwares as well. And finally comes research publication, where again it's the publication or the journals, they work in a different way. There are a lot of issues which the editor has, and then how your research article is submitted, and then it goes for review, it goes for peer review, and then they suggest you changes, minor changes, major changes, what is the acceptance rate, which journal should you send your article. So there are a lot of issues with respect to how you publish your research as well. And then we also do Mendeley and Zotero are the free reference management software. So these are some things which will help you in managing your references, which again is a important aspect of publication and report preparation, because they have their own way of how you quote previous studies and previous research. So that was briefly about research and introduction, which I could actually finish in about 40 minutes. Now, where do we go from here is my question, and I'll now come to the question answer box, and I want some feedback from your side as to how uh, you want things to move from here, right? Because here after I want things to be interactive. So can we have certain things in the question answer? If you have any specific queries, as of now what I can see is I have 12 viewers. Can we have something in the question answer box? I am not sure how this webinar went, because it's not a very easy thing to look at the screen and talk, especially when you're not getting any feedback. And at times I didn't even know if I was connected, or did I get disconnected, or were you able to hear me other than the few messages I was getting on the phone, which gave me a feedback in the initial 5 minutes as to how things were going. So, okay, okay, now I think it's a Pankhuri's question which says, what is the usual criteria for selection in ICMR projects? Now the answer is uh, valid not only for ICMR but any place where you are applying for a grant. Okay, any place where you are applying for a grant, the thing is the research. First, what is the need for the study in the sense when you write the introduction and review of literature. Now, each organization has its own priority areas, right? So if it's about NCDs, non-communicable disease, if some association is working very deeply into NCDs, they would probably fund you a research which targets towards the NCDs. So you have to find what is the area of interest of a particular organization which is willing to help for you. As far as ICMR is concerned, it's a very broad association. They don't have any specific topics which they want to fund. They just want to fund good medical research. But the thing is, first thing which they would see is the need for the study, whether this study is justified, what is the need for this study. Second thing, what they would see is how well the Indian population would benefit from your study. That's a big thing. What is the actual benefit of your research? And third thing which they would be interested is on a very good research design, because nobody would want to fund you uh, for a research design which is flawed, and because whatever data you generate out of a flawed study design is of no use. Okay, so that was one question by Bankuri, and the other is, it was very descriptive. I learned a lot of which I don't know. Okay, so this something with common from MSAI's website, and then some other queries. We still have a few viewers with us. Any other questions, or shall we close it down? Can we have some other feedback as to feasibility of such webinars? How did it go? And other feedbacks like what should be the timing or a day when we can have this? And the third thing is, what would you want to have in the month of February as your topic? So if there are no further questions or queries, I'll stop this broadcast right now. We would need to do some thinking as to how to improve the quality and make it more useful, both in terms of the technical aspects of presentation as well as in terms of setting the timing and days such that we get a good participation. So that can be done. You can always drop me a mail and we can discuss these issues and try to improve on this uh, uh, series. It was the first, so I do apologize for all the delay and technical issues which we had, but your feedback is very important on how we can improve this and take it further, right? So with that message, I would now stop the broadcast, but I am open for your questions or queries which you can always drop to me via email, right? Thank you.